Rare scenes of civil disobedience in China are making headlines, and similar protests have been held beyond its borders in a show of solidarity against the country's zero-COVID policy. So how severe is China's containment strategy? What ultimately triggered the rampant public discontent? And what looks to be China's endgame with regard to COVID-19? Welcome to Issues and Insiders. Today we address the rebound in COVID-19 infections in neighboring China and its related repercussions, including public protests against stringent pandemic restrictions. For more, I have Professor Kim Moon Kyu from Yonsei University here in the studio. Professor Kim, welcome back.
Thank you for having me.
I also have Jonathan Cheng live on the line in Beijing. Jonathan, it's good to see you again.
Hi, good afternoon.
Right, Jonathan, first then, what can you tell us about the current COVID-19 outbreak there in China, and a little, please, about its stern containment policy?
Sure. So in the last few weeks, really, we've seen cases start to go up again, and that's obviously a reflection of the fact that it's winter, and it's a reflection of the fact that this Omicron variant that we're still dealing with is very easily transmissible. So we've seen that all over the world, and there's no reason to think that China would be an exception. And yet the difference, of course, is that China hasn't vaccinated its population to the same degree that many other countries around the world have. And the difference is that China has never let up on its sort of zero COVID strategy here, which really just means using some of these same tactics that were used early on in 2020 when we first encountered the virus, locking down compounds, keeping people at home, lots of PCR tests, face masks, and restrictions on movements. And so, I think when you put those two together, rising case counts, more infections, and more government worry about the virus spreading with that 3 years of unchanging COVID rules, and what you basically have is you have a recipe for dissatisfaction and frustration across the country, and that's what you're seeing with these protests.
Right. And Professor Kim, as a doctor yourself, what are your thoughts on China's zero tolerance to COVID-19? I mean, how feasible is this policy?
When we make a policy, we have three things to consider. We have to first think about the virus, what kind of virus it is. Second, we have to think about the human factor. And the third, a social factor. So if we concern for Omicron right now, it's not that virulent as much as the previous Delta variant. So even though you catch it, you might recover very easily. And the other thing is about the transmission. We mentioned about the reproduction number of this Omicron variant is higher than 18, which means it's almost an airborne disease, such as measles. So it's very, very difficult to control this kind of virus right now. And second, when we talk about the human factor, we have to mention of the immunity the humans have. So if you are previously infected, or if you had vaccination, that means you are somehow immune against the infection. And the risk factor the human has, such as high age or underlying conditions. And the medicines, whether the medicines are available or not. So that's the second thing we have to consider. The third thing is the social factor. What kind of policy they have, quarantine policy the government has, and the compliance from the general population, and also the capacity and reserve for critical care. Those three things are going all together, and they will finally result in some kind of policy. But as I mentioned, if you have a reproduction number that high, I don't know whether this kind of zero policy will work out or not. And if the Chinese population still needs some vaccination, especially for the elderly group, I think that should be a #1 priority instead of zero corona policy. So from a purely scientific perspective, I think it will be very difficult to maintain zero policy.
Right, and that being said, Jonathan, COVID-19 lockdowns in China, they're nothing new. I mean, authorities have been cracking down on the virus since the start of the pandemic. And that being said as well, do you believe there was a trigger, perhaps, that set off this rare display of public discontent?
I don't know that there was any one particular trigger. I think what it comes down to is that 3 years is a long time for anyone to have their lives basically put on hold. If you're a parent, you worry about your child and their schooling. If you run a small business, or if your income relies on being able to go to work or sell things, or to travel abroad, or even to travel within China, you've basically lost that income for 3 years now. And I think for a lot of people, they're coming to the end of their rope. And I think a lot of them are really just concerned about how long this is going to last. And when you look at the messaging from the Chinese government, People's Daily is, the Communist Party's main newspaper here. And they've been saying persistence is victory. That's their mantra that they keep repeating going into the winter. And as cases went up, there was a question, well, are we going to have another 3, 4, 5 months of this long winter where nobody's going to go outside, and those of us who are reliant on going out to work for our income, what about us? And there were some signs, and there was a little bit of hope in early to mid-November when the government put out these 20 measures that seemed to suggest that China was starting to move towards a more, I guess what a lot of people would say, a more reasonable policy. And I think what happened was people read perhaps too much into those 20 measures and thought China's moving towards reopening. And then it took a few days for that hope to get crushed. And I think that's really what we were seeing there, is that people were saying, it's already been 3 years, we're entering the 4th year of COVID, and we have these measures that look like it was going to make things easier for us, but actually no. And I think when you put that all together, I think for a lot of people, that was just the last straw.
Right, of course, public fatigue. It's something we suffer from as well here in South Korea. Professor Kim, health authorities outside of China, in the US, they say that China should move away from its draconian containment efforts and perhaps focus more on boosting their elderly, which is something you mentioned as well. Would you like to elaborate?
Well, I don't know the close data from China, but at the beginning of this pandemic, there was a curve of the daily tally showing how many patients are occurring from each country, and they made a curve from the logarithmic curve, and the logarithmic curve should be a line like this, and there should be no bend in it. But I'm sorry to say that in China there was a bend in that curve, so that makes that the data coming out from China is not trustworthy. And I think China wants to keep the daily tally as low as possible. And if you just keep on that policy, you might make some mistakes. So I'd like to briefly compare with other countries, such as Sweden and Taiwan. If you say that COVID-19 is a long, dark tunnel, I would say Sweden had a policy just to go into that tunnel and came out of it as soon as possible. Taiwan is something the opposite, not to go into that tunnel and make everything ready, like vaccination or something. So I think Taiwan was very quick to start quarantining people coming from Wuhan, and even before the WHO declared a pandemic, and they prepared all the masks and everything. And Sweden had no lockdown all through this pandemic, and the mortality is not that high as other European countries. So I think they had a successful story. And when you plan a quarantine policy, there should be another consideration for any urgent situations, such as a fire or something. If something more urgent happens, you might have to partially give up something you are planned to quarantine. So that's something happened in the Western China. So the collaboration from general population is one of the key components to make that quarantine measure successful. So I think the Chinese authorities have to go more into the subject.
Right, they have a lot in their hands then. And Jonathan, the public protests in China, they've spread beyond borders to even here in Seoul. That was last night. We have protests also taking place in London, Paris and Sydney, to name a few cities, of course. What do you suppose the broader implications of this reality for Beijing's fight against COVID-19?
Yeah, that's a great question. And actually, before I jump in, I should acknowledge what Dr. Kim said there is right, which is that, the concerns about people being trapped in a fire, I mean, that was actually the most proximate cause. You asked me earlier whether there was a trigger for it. And of course, it was in Xinjiang where you had 10 people, according to the official media, died when a fire broke out in an apartment building and people weren't able to get out. Presumably because of COVID restrictions. But yes, you're right that these protests have really spread around the world. And I think that's a reflection of the fact that while this is about COVID at the core of it, there are obviously a lot of other concerns that are wrapped up with it. A lot of people see COVID in China as a metaphor for government control and how Xi Jinping is tightening the government's control of society. And, so I think when something like this happened, there were already people who are skeptical of China's numbers, who are skeptical of China's policy, and who are skeptical of China's direction. And so, as you can see, I mean, with all those images that are showing up there on the screen, I mean, it's not just about COVID. A lot of it is about the Communist Party in general, and a lot of it is about what China is doing on the global stage. And so, in that sense, it's no longer a protest just about COVID policies, because obviously people in Sydney or London or Paris, they're not the ones who are actually suffering directly from these lockdowns, but they see a metaphor in it.
Right, and you wonder how all this is going to unfold. In the meantime, Professor Kim, the isolation period for COVID-19 patients in China was reportedly 10 days, but it has now been reduced to 8 days. Some countries recommend 5 days. What do you say with regard to the recommended isolation period?
Well, at the beginning of this pandemic, it was about 14 days in Korea. And as we learn more about this kind of virus, we know that after the onset of symptom, 11 days is enough. Even though you are PCR positive, you don't just spread the live virus into the air. But as new variant emerged, that kind of period was shortening. And right now we have Omicron, and Omicron has a even shorter duration of transmissible time. So in Korea, we keep, if you get COVID-19, you keep isolated for 7 days. And afterwards, you might have to wear a mask in a public place or something.
Even if you're outdoors?
Even, yeah. And in European countries, some of the countries choose 5 days is enough after the onset of symptom. And you might have to wear the mask for 5 more days in a public space. So that would end up in 10 days. China chose 10 days to 8 days. And I think it's kind of based on some articles that after 8 days, you might not have any live virus spreading. So that's reasonable. But in a perspective of public health, the longer period is the better. And sometimes you might have to shorten it because some social issues. If you do not have any doctors or drivers or any person to work in the society, you might have to shorten the period. I think that is the prime reason that some European countries just shortened the time to 5 days.
Right, unfortunately. And Jonathan, this is going to be a very quick question, maybe 30 seconds for you, but do you suppose a tangible ease in stringent COVID-19 restrictions there in China will serve to appease public anger? We have 30 seconds.
I think we are already starting to see that response from the government. I think they recognize that, as Dr. Kim says, the social costs are really starting to mount, and I think the protests really sort of put an exclamation point on that. So we'll see how quickly they move, and we'll see whether or not that's enough to appease public anger.
Right, I see, and hopefully you'll be with us next time to tell us more about that. All right, Jonathan, as always, thank you very much for your time and your thoughts, and Professor Kim here in the studio, thank you very much for your insights.
Thank you.
Thank you.
Right, well, that brings us to the end of this edition of Issues and Insiders. As always, thank you for watching. See you on Friday.